Top Med Talk. Hi, it's Monty Mythen, Editor-in-Chief of Top Med Talk, coming to you live from Anesthesiology 2018. I've said that so many times at this conference now. I'm losing it. We're getting a little bit tired now, folks, but bear with us. So we're sitting down for our last session recording at this year's ASA annual meeting here in San Francisco in the USA. And we have a repeat offender.
We're finishing with a bang now. That's good.
We're sitting down again with Desiree, Chappell co-host, and Mike Grocott for this closing session. But we managed to grab Davinder Ramsingh. He's from Loma in Southern California, who very graciously sat down with us last year, and we spoke about ERAS for cardiac surgery. Yes. And then I managed to get you on the phone from the studio in London mid-term, and we spoke a little bit about ultrasound.
Yes.
Okay. So let's dive straight in. Tell us about POCUS, what it means.
Sure.
We talked about. I know everyone jokes about hocus pocus.
Yes.
But yeah. How's it going, and is it getting traction? And what's been happening at this year's ASA?
Yeah. Well, first, thanks again for the invitation. Always great to be part of this, and to close it off, that's phenomenal. Thank you again for the opportunity. POCUS is the idea, as we talked about, not to be associated with hocus pocus, but to the degree of incorporating ultrasound into our bedside assessment. More and more attuned to the physical examination, how we use our stethoscope, but now as ultrasound technologies have rapidly changed to allow us to really bring it to the bedside more and more readily, how we can use that to assess our patients.
Excellent. And it's getting traction here?
Absolutely. It is. You see the number of workshops, the attendance of these workshops, they're all increasing in number. The panels have increased in number compared to last year. Publications, abstracts have all increased in number. So it's great. It's really becoming a mainstream topic. And to highlight it further, it is something that is getting accepted, I think, as for the specialty of anesthesiology, not so much just focused on the idea of a specific subspecialty, but the idea that general anesthesiologists can embrace this topic.
And as we talked about before, ultrasound is ubiquitous in the world that we live in, the well-resourced world, particularly in the world of anesthesia, critical care. Around the time that certainly in the United Kingdom it became a requirement for the replacement of a central line, Mike, they just popped up everywhere, didn't they? So
they did. We have them on all our units. You've got them in the operating suites.
So there's no good reason not to be using it. Desiree, did you have
that? Did you just say you have an ultrasound machine?
Yeah.
In every OR.
In the operating suite, so you have one available.
Yeah. Okay. I was say, wow. Yeah. Absolutely.
Yeah. There's nowhere we work where an ultrasound machine, where we work, where an ultrasound machine is not available, if you see what I mean.
Yeah.
And increasingly we're seeing people having their own handheld ultrasounds.
Right.
Has that moved on even further? Because the last one, palm of your hand sort of thing.
Yes, now they have ones that plug into your smartphone, turn your smartphone into an ultrasound machine, and recently FDA-approved devices in that area. And so it's very exciting to see how this technology just gets more portable, more economical, more readily available.
Fantastic.
So as a bit of a dinosaur in this respect, and certainly not an ultrasound expert.
Which sort of dinosaur? A raptor or a... Go on.
We don't need to.
It's been a long day.
We'll talk about that later.
But so I kind of feel myself getting a little nervous here. I mean, when do we get to the point where you can't be an anesthesiologist unless you can do POCUS, which presumably is a logical step at some point?
That's that's a question. I think that it's absolutely a justifiable question as the technology is available. The way I'd answer that is that we need to develop the processes on education, certification before we can even approach that area, right? And I think we're still very much in the idea of awareness about what POCUS is, how we can use it. We're still in that development phase, doing the research to show and demonstrate, but it's exciting. Every year there is more research, more awareness on the topic, and we're proving that it provides an improvement in perioperative care. Every year it's growing, and so hopefully time will develop how we can address those issues.
Do you think we've reached the boundaries of application? Do you think people have worked out where to stick the probe as far as they can stick it?
Absolutely not. That's what gets so exciting about this, is that the more people you have from different backgrounds using this technology, you find new ways, new questions to answer with it. This is how gastric ultrasound became available. Yeah. People have used the idea of abdominal ultrasound for many, many years. You put it in the hands of anesthesiologists, and now they're starting to answer questions about MPO status. That's a perfect example. Using the assessment of cardiac function in different ways, looking at the diaphragm and motion of the diaphragm. These have been techniques that have been in the history of pulmonary POCUS or other specialty ultrasound techniques, but now as anesthesiologists embrace it, we're answering different questions with this technology.
And how much? We can answer the MPO status question. Does it matter if everybody's scanning somebody's stomach?
Yeah. How much? I mean, medical imaging. In general, the kind of machine interpretation as opposed to human interpretation. How much of that can we do with ultrasound?
Yes, so more and more that the idea of machine identification, augmented image analysis and facilitation of that is developing, and it's every year again. These technologies that used to be on 200K plus machines are just getting titrated down to these more portable systems. So the same analysis techniques and tools that were locked into your cardiac suite are now becoming available in these pocket devices. So it's an exciting time. And again, just to reiterate one more time, the technology is happening much more rapidly than I think we're ready to embrace it.
Okay. So this is a slightly geeky question, but so, the sort of geospatial mapping.
Love this. Yes.
So you can use your GPS and you can take a picture here and you can stitch it all together. So at some point, can we have, you stick a marker on the sternum and every single image starts to be pulled together into a whole body image?
Yes, exactly. So, and there's different ways to address that question. There's ways that you can take the image that you're getting in 2D and reconstruct that into 3D without sort of a sophisticated, expensive equipment. And there's other ways now to develop ultrasound that used to be the main requirement being on this crystal technology. That's even getting broken down, and other technologies are now existing that allow you to get ultrasound imaging for a lot cheaper, which allows you to design different probes, different sensors. So it's again, very exciting to see what the future holds for this technology.
Now, I think pretty much everyone's convinced that it's got a lot to offer, ultrasound. Any red flags, any unintended consequences?
Oh, absolutely.
Run a few of those ones.
My own personal story. I made the mistake of scanning my daughter when after 6 months after being born. I saw her PFO, and it didn't close until she was over 2.5, 3 years. And so, unnecessary exam without a question, which is not the definition of POCUS, right? The idea of POCUS is you have an acute situation, you have a question that you're trying to use ultrasound to address. If you start just scanning, this whole body imaging kind of thing, finding pathologies that are really not pathologies, finding things that are not clinically relevant definitely allows itself to develop. So we have to be mindful of that, So
if your question is, I wonder if the patient's bladder is full post-operatively,
insert ultrasound.
Ultrasound could answer that question, but don't go looking.
Correct.
Yeah. Just don't go poking around, see what you can find.
Don't do what I do.
Okay.
Do what I say.
So if someone wants to get started, and I've asked you a little bit this about before, but if we all wanted to get started, for example, what would be the best way to start?
Well, I'll try to answer that. I mean, there's many platforms now, more and more free medical education. This group here is incredibly involved in this space, but free medical education online is rapidly growing. And when you just do simple searches in Google for point-of-care ultrasound, you'll find many platforms. I'm involved in a platform that offers free medical education on foresightultrasound.com, FORESIGHT ultrasound.com. It's completely open source, copyright free. It's our attempt to make free medical education on the topic, but there's many other platforms you can use and that exist.
And if you want to go and hang out, there are courses I've seen around the various places, but I think you've got one that takes place in Southern California.
That's right,
which
Huntington
is a terrible place to go.
No, we do have a course. POCUSeducation.com is how you can get a link to that. It is in Huntington Beach in September, this coming year, 2019, It's September 28th and 29th. Come, you can get a lot of hands-on training, see the latest technologies on POCUS, and hopefully learn how you can use this new bedside tool.
And say it for us one more time. It's
POCUSeducation.com.
POCUS, and we'll put that link on the article that we put up, which I think we did on the one before. But they all seem to be selling out these courses now.
Yes, it's very much. The number keeps going up. We have to really try to titrate what number we can actually handle.
I'm sure there are many other courses available out there.
Absolutely. Simple web searches. I appreciate the plug, but simple web searches will definitely show that there's definitely other folks doing this, and they're all great courses.
Oh, I'm sorry. I was just saying, is there anyone can sign up?
Yes,
for that?
Absolutely.
Yeah. It is not a non-physician provider.
Physician-only provider. No, it is a venue for the education on the topic. Cool.
And the newer sort of low-cost tech, the iPhone or smartphone, what sort of price is that coming down to now?
So several $1,000s. That's so you're taking devices now that used to be, not something that somebody would put on as a personal device, all right? But now, to the point where now you're talking about 2 to 3 times the cost of a very expensive stethoscope.
Wow.
Impressive.
Desiree, any other questions? I can see you're thinking about going on a POCUS course in Southern California as soon as possible.
On my birthday.
Right on the beach.
Actually.
Vinny, you know what you should do? You should have Top Med Talk there.
We should.
I would. That
Let's
would be
do it.
phenomenal. That would be great.
Yeah.
We could do it on the beach.
We can work something out here, don't you think?
I think we can make it work.
We'd have to do it in the gaps between the learning we might join in with.
You need a dinosaur there.
Yeah, I was going to say.
We'll identify what that will be. That would be wonderful. It'd be a great opportunity. And, I think this topic is rapidly growing. And appreciate the awareness on it and the interest for all your listeners. I know there's a large amount of people that are interested in the topic, and it's exciting to see how it's changing.
Yeah.
No, but any other takeaways from the ASA this year for you? Any other big picture things? Or
I think more and more every year at ASA, I'm always amazed about how innovation is getting more and more supported by our specialty, right? We're testing the limits every year. I think there's more of an emphasis on saying, okay, what is the next big thing? And that's getting more of a mandate as sort of a mainstream, not so much in the corners of the conference. More and more now we're talking about, okay, well, how are we going to identify this in a more rapid manner? And so that's been very exciting to see.
Excellent. Well, thank you once again for giving up some time to talk to us.
My pleasure. Thank you.
Good luck with your work. Good luck with the course. Close out by saying, Mike, you've been very generous with your time, as you always are. Desiree,
thank you.
Well done. Great job.
High five, man.
Another great meeting.
Great job to you.
And the team that's been supporting us, Nick Majerus and Henry, thanks very much. Thanks to the ASA. Thanks to Smith's Medical. Thanks, everyone.
That's right.
Okay, now
Thank
I
you all
think
for
we
listening.
can almost go for a break. We're going to have to draw for this Marshall amp soon. So if you haven't subscribed yet, you've got about 90 seconds.
Dave, do you have a dummy email that you can throw in for we're giving away this speaker right here. If you sign up for Top Meg Talk today.
Okay, yeah, no.
And you'll get us over the 100,000 downloads because we're so close to getting over the 100,000 downloads.
I'm on it.
Make sure if you're listening and you have subscribed, make sure you've downloaded our back catalog. I know we talk a little bit about that, but
that's because the 300 plus downloads are free at the moment.
I'm pulling my phone.
So if you get your residents to go in, they can have the full back catalogue for free. At some stage, that's going to go organised in behind some kind of a paywall.
Oh gosh.
Our front end ones will always be open access, but it's getting unmanageable now, the content.
Sure.
So we're going to have to get it organised in a way. There's some brilliant stuff.
And I will say that I follow it. I listen to it. It is great. It summarizes you do a phenomenal job of keeping a pulse of what's happening. And it's an easy tool for us to kind of stay abreast of what all the changes that are occurring. Thank you for all your
great
work.
plug.
I know.
That's sincere as possible.
So we've heard that for a few people, but maybe some of the people come over and hang out with us that give us that bit of bit of information.
It is your brainchild, Monty, and we just want to say thank you. It's your baby.
We're getting a bit too
sentimental.
We're getting a bit too fond of each other now, a bit too self-congratulatory. So for those of you listening around the world, we're signing off now. For those of you at the ASA, we hope to see you here next year. If not, you can come and find us if you want to hang out with us. At all of the EBPOM meetings we have at Top Mid Talk Show, go to ebpom.org. And our next formal meeting that we're in, I think, is
State of the Art.
No, for us, for EBPOM, I think it's probably the Dallas.
EBPOM, I see what you're saying.
Dallas.
The EBPOM USA Dallas meeting.
Dallas next March.
March 22nd through 24th.
Exactly. And then we've got London, we've got Dingle, we've got Chicago, we've got Hong Kong, we've got Singapore. We don't go to all of these, unfortunately. Hong Kong, Singapore, Australia. Have I missed any?
That was pretty comprehensive.
Okay. Right, everyone. Thanks very much for listening.
Cheers.
Thank you.
Top Med Talk.